Well, welcome everybody. Thank you for coming to learning about health services management. My name's Fran Lukasik, and I do teach AH 101, and I'm also the coordinator of the Health Services Management Program. So let me get started today. Let me start with some questions, something that you want to think about. Do you like to solve puzzles? Do you like to investigate? How about gathering information to come to a conclusion? Do you really like to resolve issues? How about leading a group? Do you see yourself as an organizer? Are you somebody who likes to be in charge? Do you like to set people up for success? Do you consider yourself a planner? Do you like to coordinate events? Do your friends look to you to get things started? How about computers? Do you enjoy working with computers? Do you think you have good computer skills? If you said yes to a number of these questions, then health services management may be a very good career for you. Now, I know that a lot of you right now are exploring different careers, and you may not have heard of health services management. Maybe you've never considered it, but it is a very exciting and dynamic career and many pathways and wonderful opportunities for you. So let's take a look at what is a health services manager? Well, a health services manager is somebody who plans, they direct, they organize, and they coordinate. Now, whether they do this in an individual department, at an entire facility, a whole entire organization, or a medical practice. But those are the major skills, the major duties of a health services manager: planning, directing, controlling, and organizing. It's the person who manages the individuals or the departments that actually administer direct client care. Now let's think about this. Your healthcare studies majors. You probably select this because you really like to help people. Well, reflect upon that. Being a health services manager is a career that really does help people. Many individuals, once they get into healthcare, they may not like to work with individuals with blood or have bodily secretions. How do you feel about being around really sick patients all the time? If you still want to be involved in healthcare, but maybe direct touching and caring for patients, cleaning their wounds, cleaning up their vomit, may not be for you, then you may want to consider health services management. So let me tell you about some of the different things that a health service manager does. All right, their whole entire goal is to improve efficiency. They really want to improve the whole entire quality of the healthcare experience. They do write a lot of policies and procedures. They develop goals and objectives that are in line with the organization or the facility or the medical practice. They make sure that we comply with all of the laws and regulations that are involved in the medical field. They recruit, hire, train, supervise staff. They also manage finances. They may develop work schedules and workflows, prepare and monitor budgets, of course, represent the facility at other departmental meetings, in the community, on government boards. They keep and organize records, and they communicate with all different levels throughout the whole entire organization. All right, all the different employees, medical staff. So there's a number of different very interesting things that a health services manager does. So where do they work? Well, of course, they work in hospitals. and long-term care facilities. But there's also just a number of other organizations that need health service managers. All the different kind of clinics. Think about all the urgent clinics that are in all the different neighborhoods, dialysis centers, public health agencies, such as maybe your local public health or state or even higher level federal government public health agencies. There's a lot of freestanding surgical centers that need health services managers. Of course, large medical and dental practices need health services managers. Home health agencies, hospice programs, research centers, laboratories, even medical product suppliers, pharmaceutical companies, insurance companies. So just a number of different areas and opportunities and locations for health services managers. So what are some of the different titles? I mean, we hear of health services management. Of course, they're going to be called healthcare managers, but they may also be administrators. They could be coordinators, medical practice managers, insurance specialists, chief operating officers, executive directors. So there's also a number of different titles that would be associated with all of these different locations that somebody may choose to be a health services manager. What about education and salary? We have a 2-year program at CCP. You can get a job and start your career off with a 2-year degree. Usually it's an entry-level job. The salary is usually around $30,000 to $40,000 a year. Most organizations like you to get your bachelor's degree or your 4-year degree. You'll see that the salary increases, almost doubles, $40,000 to $80,000 once you get your 4-year degree. And as you gain experience and as you work in the field, many go back for a master's degree, and then that's when they really start to make a lot of money, 80 to 100 to well above 100,000. That comes with experience, and that does come with education, so keep that in mind. All right. Employment outlook is excellent. We do expect healthcare to continue to grow. There's going to be many opportunities. Just think over the last 4 or 5 years, how many different surgical centers, minute clinics, urgent clinics have appeared all over the Philadelphia area. These types of organizations are only going to continue to grow. So what are some of the skills that are needed? Well, good communication, of course. You're going to be speaking with other healthcare professionals. You may be speaking to the community. Of course, you're going to be speaking to your staff. You also deal with patients. You may be speaking to patients, physicians, insurance companies. So you do need to have good oral communication skills, plus writing skills. Of course, remember, you're going to be writing things like policies and procedures and manuals and handbooks and things like that. So good written. And of course, you need to be a very good listener because you are going to be that person in charge. Detailed oriented. When you schedule, you got to make sure that all of the different positions are covered. Budgeting is very important. Make sure that you are staying in line in your budget. You got to follow procedures, maybe be involved with billing. Of course, you have to be a leader because you're going to be training individuals, motivating individuals, leading a staff. Analytical because you really got to investigate. You have to adapt various laws. And with technical skills, of course, that would be able to work with computers. So what are some attributes? Do any of your friends, or do you think that you're enterprising or motivational, ambitious, energetic, enthusiastic? How about confident, helpful, or tactful? Well, if any of these words describe you, then this is a great field for you. So let me tell you a little bit about health services management here at Community College of Philadelphia. Of course, I said it's a 2-year program. It is a select program, so you do need to talk to an advisor. They will help you fill out a dynamic form. And in order to fill out this form, there's 2 requirements. You really need to be Math 118 ready and English 101 ready. And if you have taken courses at CCP, or if you're transferring in, you do need to have a grade point average of 2.0. That is what it takes to get into the program. The program at Community College of Philadelphia really is meant to be a transfer program. We want to get you ready for that 2-year college or that 4-year college that you want to get to go to. And even in your first year of school, it's not too early to start thinking about where do you want to complete your 3rd and your 4th year. That's really important because we have a number of transfer opportunities, a number of dual admissions, some core-to-core where you take your general education courses at CCP and they transfer seamlessly over to another university. If you fill out transfer agreements, and we have transfer agreements with all of these colleges that I have listed here, all you need to do is fill out a piece of paper, fill out a form, and automatically, if you maintain a certain GPA, and every school is different, you are automatically, seamlessly can just move when you graduate from CCP right into that college or university. You don't have to go through another application process. You don't have to go through an interview process. You're accepted. They accept you because of your performance at CCP. We have a number of individuals that have gone to Drexel. They really have enjoyed it. Drexel really likes to work with us. They sit down with you. They'll tell you all of the courses that you took at CCP and how they transfer over. At one time, we had a number of students go into Arcadia. Arcadia, we have more of a core-to-core where they take our general education. Lately, a lot of the students have been telling me that they've had to repeat some of the courses, but yet Arcadia is a great, great university. Immaculata has a relatively new program, and it is predominantly online. A number of our students have gone to Jefferson University. That's the old Philadelphia University. And we have very specific charts and graphs that show you what course you take at CCP, how it transfers over, to Jefferson. Pierce, many of our students are really starting to go to Pierce. Pierce really works with our students. They will sit down with you. There's 10 core courses that you have to take at Pierce, and then they'll give you the option to take these other courses, and they'll say, well, you could take them at CCP if you would prefer, or you could come and take them here at Pierce. But there's 10 that you need to take here at Pierce in order to get your 4-year degree and graduate from Pierce. St. Joseph's has a program that's specially devoted to the individuals that work during the day. It is a adult business program, it's called, and it is held at night. All of them are wonderful, but each has their own little unique characteristics, and that's why it's important to see, where do you want to go? Because, for example, Pierce really likes you to take economics, and economics is not one of the required courses at CCP. But you can take it at CCP and it can be transferred over. So a lot of the times, once you know where you want to go, it helps you select your courses. Like Jefferson, they like a history course, and under our humanities, you could choose a history course, but you could also choose a number of courses like humanities, cultural traditions, critical thinking, in philosophy, and a number of English courses. So if you know you wanted to go to Jefferson, you want to take a history course. Some of the different courses, you'll see many of them coincide with healthcare studies. You start off with all of the 100 level allied health courses, such as medical terminology, the administrative procedures, the interpersonal skills, and the reimbursement. You probably will already be taking all of these because you are a healthcare studies major. Then you move into the 200 level courses, 200 medical law and ethics. There are 3 courses that are really geared towards health services management students, and that would be our healthcare policy course, our current issues and trends course, and of course supervisory management. Now these 3 courses have prerequisites, so it's very important that you take things in certain order so that you're able to take these courses when they're available. Now, as you move up from the 100 level courses, you're going to notice that there are many different sections. By the time you get into age 222, 224, and 260, there's usually only 1 section a semester. And we offer it usually once at night and then once during the day. So if individuals are working during the day, they could take it at night. And if they're working at night, they could take it during the day. So if you're working during the day and you only need night courses, you would have to take age 260 in the fall and age 224 in the fall. Now that is, of course, when we go back to the traditional classroom. Right now, everything is online. And for the spring, everything would be online. But by the time you got to these courses, we should be back in the classroom. And that's important to understand how to manage because there's not many sections. One thing about 224, it's offered in the fall. And typically, if we were in the classroom again, it would be offered at night, and then it's offered in the summer. But if you'll notice in the catalog, it'll tell you to take it in the spring, but it's not offered in the spring. So that's why it's important, if this is your major, that you set up a meeting with me so we could map this out, that you could get all these courses in the least amount of time. Some of the other courses that you would be taking, of course, would be accounting, because remember I said you're going to be involved with budgeting. You do have to take science courses, so we do have biology, but if you're in health services management, of course, you need to know about the body. Everybody needs a computer course at CCP. Everybody needs to take an English course. You do need 2 math courses, the Math 118 and then either the Math 251 or Math 150. Now again, many of our transfer colleges prefer Math 251. So if you know where you're going, I tend to recommend the Math 251 over the Math 150. You get your choice of one social science course, usually either a psychology, an anthropology, or a geography course, and then you get to take 2 humanities courses as electives, and those would be from a selection, a list of English courses, history courses, humanities courses, philosophies courses, and even Spanish. So there's a number of very interesting courses that puts this together for your 60 credits that you need to graduate. That's the program in a nutshell. Again, I'm Fran Lukasik. That is my email address, and I'm available for Zoom meetings to meet with you individually to further discuss it. And that would be my phone number if we were working at the college, but since we're working remotely for now, but in the future, that would be a good number that you'd be able to get a hold of me. So I really appreciate that all of you took the time to come and listen to our program. Does anybody have any questions?
Okay. No questions? Be sure to enter your name and professor's name in the chat as a way to sign in. And we will post this recording up so that you can listen to it again. And I hope you've jotted down Fran's email so you can contact her if you think of any questions.
Laura, I'll send the slides along as well if any of the faculty want to upload them in their
Okay,
course.
that's
They can
great.
feel free to do so.
That sounds perfect. Okay, so everybody's all set?
All right. Well, thank you
Thank
again.
you, everyone. Thanks, Fran.
Thank you.
I'll send that out today along with the chat. I don't know if I hope all the students signed in. Tina, Matena, Tashira, and Excel, 1, 2, 3, 4, 5. All right. Okay.
All right.
Bye, guys. See you Friday.
Bye.
You can make it.
Yay, Fran.
Fran. Woo, woo, woo. All right.
All right. See you
Bye.
guys.